Hello, my name is Dr. Todd Willin, and I'm a pediatrician in Pittsburgh, Pennsylvania. Like you, I vaccinate a lot of children every day in my practice. I recognize that discussing vaccines can be challenging. Today, I'm going to be talking to you about two different ways to approach vaccine recommendations to parents and caregivers. Specifically, I'm going to discuss two different ways to discuss the fourth dose of PENTACEL at the very crowded toddler age well visit. Keep in mind that PENTACEL vaccine is administered as a 4-dose series at 2, 4, 6, and 15 to 18 months of age. Important safety information for PENTACEL vaccine. Contraindications to vaccination with PENTACEL vaccine include a severe allergic reaction, in other words, anaphylaxis, after a previous dose of PENTACEL vaccine, any ingredient of PENTACEL vaccine, or any other diphtheria toxoid, tetanus toxoid, pertussis antigen-containing vaccine, inactivated poliovirus vaccine, or Haemophilus influenza type B vaccine, encephalopathy within 7 days after a previous dose of a pertussis antigen-containing vaccine with no other identifiable cause, or a progressive neurologic disorder. At the toddler visit, a potential challenge can arise around administration of the inactivated poliovirus, or IPV antigen, with the fourth PENTACEL dose. While the Advisory Committee on Immunization Practices, or ACIP, recommendations state that it is acceptable to administer 4 doses of IPV before the 4th birthday, only 3 doses are recommended. Questions may arise around why an extra dose of IPV can be administered. The way a healthcare provider recommends vaccines to parents may have a direct impact on whether a parent decides to accept or refuse immunizations at that visit. One approach is called presumptive, in which I announce my recommendation for the child to receive a vaccination that day. The second approach is called participatory, in which I would offer different vaccination options to consider. An observational study investigating 111 vaccine discussions in 9 practices found a 74% initial rate of acceptance when a presumptive approach was used. The initial acceptance rate was only 17% when a participatory approach was used. Let me show you some examples of these two approaches. Emma's exam looks great. She's due for some immunizations today. Is it okay if we discuss your options?
Yes, please.
Here are your 2 options. First, we can give Emma her 4th dose of PENTACEL. PENTACEL is the same vaccine she received at 2, 4, and 6 months. It's a combination that contains vaccines for diphtheria, tetanus, and pertussis, or DTaP, Haemophilus influenza type B, or Hib, and polio, or IPV. Now, IPV is an optional immunization today. The second option is to receive just DTaP and Hib as 2 separate injections.
So if we give PENTACEL, my child will be receiving an extra dose of IPV that isn't recommended in the vaccine schedule?
Correct. The extra IPV dose is an accepted option, but it's not required. But keep in mind that using PENTACEL will mean your child receives just 1 injection instead of 2.
So why would I give my child a vaccine she doesn't need? I've been reading about vaccines online, so I know there must be some safety risks. Can you tell me more about the safety of the polio vaccine?
Sure.
Well, I'm just not convinced that the extra dose of IPV is the right choice, so I'll go ahead with the separate DTaP and Hib.
The participatory approach has been shown to be less effective in achieving same-day vaccinations. This open-ended approach can result in lengthy discussion and create unnecessary doubt and questions, ultimately causing the parent or caregiver to reconsider the 4th dose of PENTACEL. Examples of this approach, which should be avoided, include: what do you want to do today about the shots? What are your thoughts on giving Emma the 4th dose of PENTACEL today? And how would you like to approach the possible immunizations today? In contrast to the participatory conversation, the presumptive approach is a more optimal method to discuss recommendations with the parent or caregiver. All right, Emma's exam looks great. She's due for some immunizations today, so we'll be administering her 4th dose of PENTACEL. PENTACEL is a combination vaccine containing vaccines for diphtheria, tetanus, and pertussis, or DTaP, Haemophilus influenza type B, or Hib, and polio, or IPV. It's the exact same vaccine she received at 2, 4, and 6 months. Most parents choose this option. Is it okay if we go ahead and order her vaccines today?
Yes. Sounds good.
Even when using the more optimal presumptive approach, some questions from the parent or caregiver may arise. However, answering these questions in an efficient and effective manner and restating the original recommendation may help increase the likelihood of parental acceptance. The presumptive conversation method is a strategic tool that healthcare providers can use to help ensure the continuity of vaccine series administration by increasing parental acceptance. We hope this will help support successful administration of the 4th dose of PENTACEL. Indication for PENTACEL vaccine. PENTACEL vaccine is indicated for active immunization against diphtheria, tetanus, pertussis, poliomyelitis, and invasive disease due to H. influenza type B. PENTACEL vaccine is approved for use as a 4-dose series in children 6 weeks through 4 years of age prior to 5th birthday. Important safety information for PENTACEL vaccine. Carefully consider benefits and risks before administering PENTACEL vaccine to persons with a history of fever greater than or equal to 105 degrees Fahrenheit, hypotonic hyperresponsive episodes or HHE, or persistent inconsolable crying lasting greater than or equal to 3 hours within 48 hours after a previous pertussis antigen-containing vaccine, seizures within 3 days after a previous pertussis antigen-containing vaccine, or adverse events after a previous dose of PENTACEL vaccine or receipt of any other tetanus toxoid, diphtheria toxoid, or pertussis antigen-containing vaccine. If Guillain-Barré syndrome has occurred within 6 weeks following receipt of a prior vaccine containing tetanus toxoid, the risk for Guillain-Barré syndrome may be increased following PENTACEL vaccine. For infants and children with a history of previous seizures, an antipyretic may be administered in the dosage recommended in its prescribing information at the time of vaccination with PENTACEL vaccine and for the next 24 hours. Apnea following intramuscular vaccination has been observed in some infants born prematurely. The most common local and systemic adverse reactions to PENTACEL vaccine include redness, swelling, and tenderness at the injection site, fever, fussiness, and abnormal crying. Other adverse reactions may occur. Vaccination with PENTACEL vaccine may not protect all individuals. Before administration, please see the accompanying full prescribing information for PENTACEL vaccine. Thank you for watching.